A warm good morning to everyone. We are here to learn the basics of the anatomy of yoga postures. Learning that will help us to improve our yoga practice and yoga teaching methods. Let me share a quick overview of the last session and what we had learned in the last session. So it will help the participants to understand what we have done in the last session. The main objective of doing this session is to understand when we need to analyze the key muscle groups involved in the yoga postures. We need to correct our posture alignments. We also focus on injury prevention and better posture correction. So these are the three main objectives of this session. And I wish this session is able to fulfill these three objectives. Now, in the last session, we had learned about 5 postures. We may not be going in detail about each posture in this session because we have new postures to unveil. So last session, the first posture was Utkatasana. So understanding the right alignment of the knee while you are practicing or making others practice, make sure that knee is over the ankle and knee is not moving ahead. Your pelvis is anteriorly tilt and the chest is broad open. Sometimes if someone pulls the chest in, it will not activate the erector spinae muscles, which need to be actively involved in this particular posture. Why we intend to do this posture, Utkatasana? Simple thing. This is a great pose to strengthen the front of the thighs, the quadriceps, and the major and the thick muscle of the body, gluteus maximus. So the reason of doing this is to strengthen these two muscles. But apart from that, we need to use the abdominal muscles to stabilize this posture. And as we need to use the abdominal muscles, there is a process of strengthening of abdominal muscles too. Apart from that, we are using the erector spinae muscles. I'll be in the postures, you'll be able to see what are those muscles. Don't worry about it. We'll be learning about those muscles. Of course, deltoid, these are the major muscles you are aware of. And apart from that, the calf muscles are involved, which is gastrocnemius, and the muscle near to it, soleus. And of course, the gluteus medius. So to perform this posture, make sure the knee is over the ankle. The major target muscles are quadriceps and gluteus maximus, and the other muscles act as stabilizers. The second posture we covered in the last session. I'm just revising the last session. So today's session will be started very shortly. The second posture we dealt in the last session was Trikonasana. So Trikonasana is basically a practice where we focus on stretching. What are the muscles getting stretched? So the muscles getting stretched are all the hip adductors. Okay. Then the external oblique muscles, which is over the abdomen. Then quadratus lumborum, again over here. Apart from that, hamstrings and the gluteus medius over here. So just a quick overview of the last session. Third posture we learned about was Utthana Padasana, which is basically doing two things: stretching the important muscles, hamstring. The lengthening muscle is hamstring, which you can see as yellow. And the muscles which are actively involved in the posture are abdominal muscles, the psoas major and the quadriceps. The fourth posture we did was Bhujangasana. Bhujangasana was a pose where the major focus is on the erector spinae muscle. These muscles marked as red are the erector spinae muscles, which runs parallel to the spine, to the both the sides. So these are the muscles involved while doing Bhujangasana. Apart from there is lengthening of muscles. The muscles lengthening are abdominal muscles, psoas major and iliacus. And the next posture we did was the frog pose, also called as Mandukasana. Mandukasana also refers to a pose where we sit in Vajrasan and place the wrist, fist on the near to the navel and bend forward. But here Mandukasana is called as frog pose. This particular posture, frog pose, is again a lengthening muscle, adductors, gracilis, and pectineus. And of course, to do this posture, you need to contract the abdominal muscles, which is transverse abdominis and serratus anterior. So these were the 5 postures which were dealt in detail in the last session. In today's session, we are going to learn about the balancing postures, which we are coming up very shortly. But we need to understand that in today's era, where people sit for a longer time on chair and sofa and all the things, where they are not using the floor for sitting, we need to understand their adductor muscles are very tight. So present day, the maximum people who sit on chair for a longer time, they need to practice the postures which will help to stretch the adductor muscles. So before we go into detail of today's session, where we are learning about the balancing postures, let me tell you what are the most important muscles of the body so that you will have a broader idea when you will see these muscles into action, into the posture, because I'll be showing each and every muscle into action. It will be a proper description of the muscles, which will be seen properly. See, first thing, we refer to the muscles called as quadriceps. So most of you who are medical students, BNY students or doctors, they are already aware the quadriceps are on the front of the thigh. Or those who are yoga enthusiasts and they practice yoga regularly, they are also aware of that. The quadricep is the front of the thigh. When you say quadricep, it involves 4 muscles. What are those 4 muscles? The rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. I'll be showing you pictures of these muscles, but as of now, I'm just giving you a description. So when you see the picture clearly, you'll be able to understand it better. And apart from that, we also have a muscle in the anterior compartment of the thigh, which is the longest muscle of the body, which is called as sartorius. And especially a posture like Vrikshasana, in Vrikshasana, the sartorius is involved. So that we'll be seeing in the coming postures. Then coming to the back of the thigh. When we talk about back of thigh, it is a commonly known terminology, hamstring. But hamstring is a group of muscles. What are those group of muscles? They are 4 muscles. Bicep femoris, because it has 2 tendons, so it is considered as 2 muscles. But as such, it is 1. Apart from that, semitendinosus and semimembranosus. Okay, these are the muscles called as hamstring. You know, in the present era, I have seen maximum school students and college students suffering from hamstring tightness. The reason, not doing physical activity and sitting for longer time, because most of them are preparing for some kind of competitive exams or some medical examinations and not moving the body. So they have very stiff hamstrings. So we need to give solutions to them, right? So understanding the different asanas which can help them to overcome their problem. The next group of muscles are called as adductors. As I was talking to you earlier, these are the muscles which tend to get stiff for all those sitting for longer time on chair. Those who are doing office work, sitting for 8 hours, 10 hours, maximum people, they find their adductors very tight. And these muscles are called as adductor longus, brevis, adductor magnus, gracilis, and pectineus. This is to just preview the terminologies. While we are seeing the posture, we need to understand these muscles will be explained. So I'm just trying to give you the preview of terminologies, what we are going to use in the coming explanation of postures. Then we have a group of muscles. Adductors are nothing but the inner thighs. These are the muscles which are in the inner thighs. Abductors, these are the muscles which are in the outer thighs. There are only three muscles. One is tensor fasciae latae, also called as TFL band. And another one which is below the gluteus maximus, that is gluteus medius and gluteus minimus. So these are the muscles which help for abduction of the leg. Apart from that, you are well aware about the arm muscles that everyone is aware of. We have learned since childhood: biceps, triceps, and deltoid. Deltoid is the thick muscle of the shoulder, which is covering the shoulders. Apart from that, the major muscles in the back are, the reason we are having this terminology is because for all the neck problems, the trapezius is involved. For all the persons suffering from the spinal issues, the back pain, neck pain, or suppose having mid back pain, the erector spinae is responsible because this gets very stiff or weak. Then we have rhomboids and levator scapulae, which is on the shoulder blades. And then we have a very thick muscle, latissimus dorsi, which almost covers the lower back, and it extends to till our arms so that we can extend the arms upwards. And apart from that, we have abdominal muscles. Now, the best way to remember the abdominal muscle is to use the terminology called as TIRE, T-I-R-E. T stands for transverse abdominis, I stands for internal oblique, R stands for rectus abdominis, and E stands for external oblique. So I have just tried to mention the important muscles which we'll be mentioning while we are learning about the yoga postures. Before we go into learning of postures, if you are new to the anatomy of yoga postures, I'll just try to show you these muscles in a quick way so that you'll understand where these muscles are lying down in the body. And that will give you a better understanding of the postures. So coming to the first compartment. So if you see the front of the thigh, what are the muscles? So I was talking about the quadriceps. So you can see this is the rectus femoris. Then you have vastus lateralis here and vastus medialis. Now there is one more muscle in quadricep, which is vastus intermedius, which is below the rectus femoris. So that cannot be seen here, but these are the four muscles which form quadriceps. So hope that gives you explanation of what is quadriceps. Now let us go to the back of the thigh to understand the hamstring. So to understand hamstring, we have the biceps femoris, then we have the semitendinosus, and then we have a semimembranosus. These are the three muscles which are making hamstring. I'm just mentioning you what the muscles I have taught you. Quadriceps, now the hamstrings. Okay. Now I was also mentioning about the sartorius muscle. So this is the longest muscle where it is placed. You can have a look. I was talking about gracilis. So that is mentioned over here. But anyways, the first compartment, I showed you the quadricep. Second compartment, I showed you the hamstrings. Now, let me show you the adductor muscles. There are five important adductor muscles. To understand that, see, these are the layers of adductor muscles. This is how that is involved in the inner thighs. So these are called as basically adductor longus, adductor magnus, adductor brevis, pectineus, and of course, gracilis is always involved here. So these are the muscles called as adductors. Okay, hope this terminology will be clear. And now coming to the fourth one, which are called as abductor, which are there in the outer thigh. There are three muscles. The one which is called as tensor fasciae latae. Second one is below the gluteus maximus, which is called as gluteus medius, and below that is gluteus minimus. So I think that gives you a clear understanding of the four groups: quadriceps, hamstrings, third one, adductor muscles, and the fourth one, what we are seeing right now, these are the abductor muscles, which focus on the abduction of the leg. Now, after getting into all these things, we are coming to understanding of the yoga posture, which is the most important thing what we are learning today. So get ready for that. So hope till now what I have told you is all about the revision of the last session, which had taught about 5 postures. Then today I was telling you about the important muscles which come into mention when we talk about anatomy of yoga postures. And I showed you the group of muscles, especially the quadriceps, hamstring, abductors, and adductors. Now let's come to the first posture of the day. The first posture of the day, what we are learning is Vrikshasana. Why do we perform Vrikshasana? Of course, we perform Vrikshasana to gain concentration, what we want for students and for everyone. Second thing is creating balance in the body. So I'm not going to talk much about the benefit parts because that you are well aware of. I'm going to deal with what I am dealing today, that is muscles. So when you see this posture, you see that there is one active leg and the leg which is folded. Now, what are the muscles which are getting involved? Okay. So as of now, you can see only a limited picture view of the muscles. I'll be showing you a detailed view of the muscles now. Get ready for that. But before I get into it, the muscles which are contracting are the abdominal muscles. The muscles which are contracting are the erector spinae, which is in the both the sides of the spine, iliopsoas, which I'll be showing you, and the sartorius, which I was mentioning earlier. And what are the muscles which are lengthening here? Here, the muscles which are lengthening is the inner thighs. And by now, you know the inner thighs are called as adductor muscles, right? Another muscle which is lengthening or getting stretched is called as latissimus dorsi. I'll be showing you the picture of the muscles. And the third muscle which is getting stretched is pectoralis major. So let's go into deep study of these postures. Now, what are the muscles which are into action? So while you are into Vrikshasana, there is a contraction of the iliopsoas muscle, which you can see over the sides. The iliopsoas is a muscle which is near to the pelvic floor, and this is getting contracted of the active leg. And I was mentioning about sartorius. See, as sartorius is the longest muscle of the body, its attachment goes below the knee. And now these two muscles are actively contracting to hold the posture called as Vrikshasana. But these two are contracting, then there, and you know, iliopsoas and sartorius helps for the external rotation of the hip. The moment you are folding the leg, you are doing an external rotation. So while you are doing external rotation, what are the muscles involved for the external rotation of the hip? These are called as iliopsoas and sartorius muscle, right? So these two muscles help for rotating the hip outside. Now, coming to the muscles which are getting involved. So now the muscles which you are seeing in red, these are the muscles which are in the contracted state, right? So what are those muscles? Iliopsoas. Okay, and the long muscle I had shown you is sartorius. This is helping for external rotation of the hip. Then the muscles getting stretched are called as the adductor muscles or the inner thighs. So the moment you are practicing Vrikshasana, it is a very helpful posture for those who are sitting for longer time, because it is going to stretch the inner thighs, adductor brevis, longus, as well as the gracilis and the pectineus muscle. So there is stretching to the muscle. The other leg, which is straight, it involves support of the quadriceps, which should be contracted. It involves contraction of the abdominal muscles, which should be stabilizing the posture to keep it straight. Now we'll see a back view of this posture. What are the muscles which are involved in the back of the body? This is the front view of the Vrikshasana. Now let's see a back view of Vrikshasana. Okay? Yeah. So this is the back view of Vrikshasana. So in the back view, if you see the active leg, the gluteus medius is active. I was talking about erector spinae. So now this is the spinal line. This is your vertebral column. To the both the sides of vertebral column, you have this erector spinae muscles. These erector spinae muscles are contracting so that the chest can open out. See here, I have clearly mentioned the erector spinae extends the thoracic spine. So there won't be rounding of your back. Your spine will remain straight and the chest will protrude towards front. And at the same time, when you're raising your hands properly, joining your palms, the latissimus dorsi, now you can see this muscle. This is the latissimus dorsi muscle, which is getting a good stretch. Of course, those people who are sitting for longer time, their latissimus dorsi muscles tend to get into contracted state. So practice of Vrikshasana will definitely help the participant to stretch the inner thighs, to stretch open the mid back and the lower back, and of course, shoulders. So these are the front view and the back view. You want, I'll just revise it once again so that when you see anything once, sometimes you are not able to understand. So I'll just revise it for you, a quick revision. Vrikshasana. Here the muscles which are lengthening are called as erector muscles, latissimus dorsi and pectoralis major. And the muscles which are in contracted state are abdominal muscles, erector spinae, iliopsoas, and sartorius. Now let's have a view of these muscles. First, the two muscles which are contracting to rotate the hip externally, iliopsoas and sartorius. Great. Second, the muscles which are getting stretched. Here, the muscles getting stretched are the erector muscles, gracilis, which you can see here over down, and pectineus, which is over the adductor muscles. Right. Now we come to the back view of the posture. Here the erector spinae muscles, which are by the side of spine, are into contracted state, and latissimus dorsi muscle are into stretched state. And of course, gluteus medius helps to stabilize this leg on which we are balancing. Right? So this is a complete understanding of Vrikshasana in terms of the muscles involved. If you have any doubts or if you have any questions, you can just put it in chat box. We can take it at the end because we need to complete this session on time. We will move to the next balancing posture. So can I have just an interaction? So hope you are getting what I am teaching you now, right now. If you are understanding what I am teaching, just write down Y in the chat box. If I get 2 or 3 replies, that is more than sufficient. Great, great, great. Thank you so much. Perfect. So now you have understood that Vrikshasana is a compulsory posture for those who sit for a longer time. This is one great outcome of the understanding. Thank you so much, Nirmala ji, Shruti ji, Smriti ji, Gayatri ji, Mahima Gupta ji, Dr. Archana, Subhashini Shini ji, Dr. Ripudaman sir, Vishalji. Thank you, and everyone who has just replied. Now let's move to the next posture, which will help you to understand the balancing. Now, the next posture I am dealing is Natarajasana. Just have a look at this image first, then I'll go for the detailed explanation of the muscles involved. Have a view of the important muscles. So now, when you visualize this posture, you find they are the muscles which are marked in red and muscles which are marked in yellow. By now, you have understood the muscles which are marked in red are the muscles which are getting contracted, and the muscles which are marked in yellow means the muscles which are getting stretched. Great. So now the muscles which are contracting are gluteus maximus, the thickest muscle of the body, the gluteus medius, and the gluteus minimus. These are there in the buttocks and they are in a layered form. The first layer is gluteus maximus, second is gluteus medius, third one is gluteus minimus. Great. Now, what are the muscles which are lengthening in this posture, Natarajasana? The muscles which are lengthening are the hamstrings, the tibialis anterior. Over here, what you can see is the tibialis anterior, iliacus, which are there in the iliac fossa, psoas major, the quadriceps femoris, and the pectoralis major. Now we have a detailed view of these muscles. Let's have the detailed view. Now, let's see the first view. The first view shows that the leg which is folded, it is stretching the front of the thigh, which is called as quadricep. This we have learned at the starting of this session. What are the quadricep muscles? And the leg which is on the floor, hamstrings are getting stretched. So first, what are the muscles getting stretched? Is the quadricep of the leg folded one and the hamstring of the straight leg. Now let's have another understanding. What are the muscles which are getting stretched? So the muscle marked over here over the chest is called as pectoralis major. Great. Another muscle is tibialis anterior, which is there in the front of the shin, right? Now, the quadriceps femoris over here is getting stretched as well as it is also stabilizing the leg. And gluteus maximus is helping for the hip extension. What is hip extension? See, very simple. When you try to bring your knee towards chest, that is called as hip flexion. When you try to move your knee away from the body, that is called as extension. This is the way you can easily remember it. Okay? For posture wise, if I give example, suppose if you do Pavan Muktasana, if you're doing Pavan Muktasana, you are flexing your hip. And suppose you are doing Shalbhasana, then you are extending your hip. That is as easy to understand that. So let's come to one more view of muscles. What are the muscles getting stretched? The folded leg muscle which is getting stressed is iliopsoas, which is lying to the front, which is again connected also to the spine line. So if this muscle is in the contracted state, it often causes back pain. So if person suffering from back pain, if they regularly practice Natarajasana, they will find and also focus on their posture correction, then believe me, they will find great relief. Chetna ji, you have asked a question. I'll answer in the last. All the questions will be answered in the last. Okay, there's only one question for pregnant women. I suggest not to practice this for pregnant women because this is a balancing posture, and any balancing posture should not be given in the first trimester, preferably. The reason they, if they fall or something, that won't be great. So we can avoid the balancing posture in the first trimester. So hope Chetnaji, that answers your question. Now coming to one more view. Now when you see the posture into action, the muscles which are getting contracted and stabilizing is the deltoid, which is there over the shoulder, trapezius, which are into action, which is helping for the scapular retraction. Then again, we have erector spinal muscle, which is extending the spine, which is helping the chest to protrude out. So likewise, these are the, let me just quickly revise again the Natarajasana. So in Natarajasana, the muscles which are getting contracted are the gluteus maximus, medius, and minimus. And the muscles which are getting lengthened are hamstring, tibialis anterior, iliacus, psoas major, quadriceps femoris, and pectoralis major. So having the view of the muscle, hamstrings, quadriceps, the one folded leg, great. Pectoralis, chest, tibialis anterior. So now these are the muscles which are getting stretched. Now the muscles getting contraction. The gluteus maximus, gluteus medius, and gluteus minimus. The muscles getting stretched, iliopsoas. And finally, the Natarajasana. Natarajasana, in this, we see contraction of the erector spinae, deltoid, trapezius. So now, with look of the muscles, you can understand one clear thing, that Nataraj Asana is again helpful for everyone who have back pain. So what is the easy way to practice Nataraj Asana? The easy way to practice Nataraj Asana is that you can take a wall support. The hand which is in the front, you can keep that on wall so that there is no chance to fall, and at the same time you can extend it properly. See, you know, when the plant is small, it is covered by fences. But when the plant grows into a tree, then we don't need any kind of fencing. So likewise, when you are practicing the balancing postures, if you're finding it difficulty in doing that, then you can take support. Once with support, your body is gradually getting adapted to the posture, you can start doing it without support. As most of the people do in Shirsasana, they start with a wall support and gradually they overcome that, and then they can do anywhere and everywhere. This was understanding of the Natarajasana. So if you have any questions related to Natarajasana, you can ask at the end. And if you could understand the muscles, great. We are moving into the third posture of the day. The third posture is called as Veerbhadrasana 1. Veerbhadrasana. This is one of the most common posture. Veerbhadra is the name of Lord Shiva. Basically, Veerbhadra was avatar of Lord Shiva. So he was considered to be very powerful. So then, as the name suggests, if you practice this every day, you are going to get a very strong body. Believe me, it works for strengthening of the entire body. If you are working on students, make them to practice this every day, because that will help to strengthen them. That will help them to improvise the way they are living, their quality of life. What are the target muscles? By now you have understood when I talk about target muscles, that means the contraction of the muscles. When I talk about lengthening of muscles, that means those muscles are getting stretched. So here the muscles which will contract will be the quadriceps femoris, which is the front of the thigh, and gluteus maximus, which is in the back of the hip, glutes. Third one is abdominal muscles. Fourth one is erector spinae. So you know one thing, these four muscles are basically the base muscles of the body. These are the muscles which are actually handling our right posture. It is the posture, these are the muscles which helps to keep the body strong. If you have these four muscles strong, believe me, you are fittest, because you need to understand these are the muscles which support the body in all the ways, while sitting, standing, supine, prone. So this muscle groups are being worked by Veerbhadrasana 1. So this is very essential posture. The participant should do it, and especially students, make sure you do this posture every day. Within 1 year, you will find very strong legs and strong abdominal muscles. Uh, Someone is drawing something on the image. Please don't do that. Please do not use an on it. Okay. Coming to the lengthening muscles. Just a second. Please bear for this technical inconvenience for a while. I'll be back. I'll just get it done. Okay. So we are back. Okay. So now again. So the muscles which are lengthening are the iliacus, which is in the iliac fossa, and the psoas major, gastrocnemius, pectoralis major, latissimus dorsi, and rectus abdominis. So one way it is contracting the abdominal muscles, and another way it is also stretching the abdominal muscles. How? Let's have a view of this. Let's have the view of the most powerful posture, Veerbhadrasana. So if you see over here, the muscles marked in yellow are the muscles which are getting stretched. The muscles marked in red are the muscles getting contraction. Now in Veerbhadrasana 1, the muscles which are getting contracted are the quadricep muscle of the front leg. Front leg, quadricep muscle is contracting. And for the same leg, the gluteus gluteus maximus is also contracting. Contraction of these two muscles, maximus as well as the quadriceps muscles. Now, what are the muscles which are getting stretched? The muscles which are getting stretched are of the back leg, First, the adductors. This adductor we studied in Vrikshasana also. In Vrikshasana also the hip adductors were getting stretched. Simultaneously, the calf muscles, which are also called as gastrocnemius muscles. And then we have muscles of the back, which is called as the latissimus dorsi muscle. Now, this gives you a great picture of the muscles which are getting contracted and the muscles which are getting stretched, right? The active leg, the one leg, the folded leg is a contracted group of muscles, and the back leg is stretched group of muscles. Now let's have another view. Apart from that, it is also stretching the iliopsoas muscle. It is also stretching the rectus femoris, basically not the all the quadriceps, but rectus femoris of the back leg. Now understand, the front leg, the quadricep and muscles are contracting and the gluteus maximus is contracting. The back leg, the iliopsoas muscle and the rectus femoris muscles are getting contracted. So hope you get an understanding. Now, if you are coming to the front line, then you will find that abdominal muscles is stretched and simultaneously it is contracting to stabilize the chest, which is pulled upwards. So those people who are doing this posture, they should make sure that chest should be protruded out. They should not pull the chest in. Then the posture won't be effective. And of course, the deltoid muscle will be active, which you can see over here. So let me have a quick revision of the Veerbhadrasana. So Veerbhadrasana 1, you can have a view over here. Then the muscles which are getting contracted, the quadriceps and gluteus maximus of the leg which is folded. Muscles which are getting stretched are the hip adductors, the inner thighs, the calf muscles, and the latissimus dorsi muscle over here. Great. And also the muscles which are getting stretched are the iliopsoas muscle, the rectus femoris of the back leg. Great. And the front, you see the stretching of the abdominal muscles. Simultaneously, it is contracting also at the lower end in the inner abdominal muscles to stabilize the posture. Now, this is about Veerbhadrasana 8. So, till now, we have learned 3 balancing postures. First one is Vrikshasana. Second one is Natarajasana. Third one is Veerbhadrasana 8, again, which is balancing. Because I have seen people tend to get imbalanced. The best way to keep the balance on is to keep the back leg in a diagonal way. So that will help. Okay. Anyway, you must be aware of the practice. And if you want to do it practically, then of course you can connect with me. I'll help you how we can do it in a practical way with a proper demonstration. This is just understanding of muscles. Now coming to Veerbhadrasana 2. So it is very interesting to learn the Veerbhadrasana 2. See, these postures, their names are just changed by numbers, but not just changed by numbers, also by the muscle groups. Let's see it. So if we see the Veerbhadrasana 2, you find the contracted muscles being quadriceps femoris, what you can see over here, gluteus maximus, again, that we have learned in Veerbhadrasana 1 also. Then apart from that here, deltoid, great, and the erector spinae. By now you are aware of the erector spinae muscle, which is by the side of the spine. So these are the 4 muscles which are getting contracted to do Veerbhadrasana 2. But at the same time, it is lengthening the inner thighs, calf muscles, that is both gastrocnemius and soleus. So this is very easy posture to understand. The front of the leg is getting in a good contraction state. The back of the leg is getting in a good stretch state. Again, one should practice Veerbhadrasana 2 before they practice Trikonasana. try this. You will feel so easy to practice Trikonasana. You will find it very easy to approach into Trikonasana. Your hand will be properly touching the floor. Your chest will properly open out, and you will find it very easy. So people trying to practice Trikonasana, they should practice Veerbhadrasana 2 first. That will always help. Suppose you are sequencing your session, you are sequencing your class, then you can keep first Veerbhadrasana 2 and then followed by the Trikonasana. Later, once we complete this anatomy of yoga postures, if you people are interested, I will tell you about the sequencing of the yoga postures. Maybe in the coming days, we can learn about the how exactly a proper sequence of yoga postures should be done. See, since almost 25 years, I'm into practice of teaching yoga. Apart from that, 5.5 years already we have learned how to practice yoga during our BNYS journey. So that 5 years plus this added 25 years helps me to train people in the right way, in the right format, so that I can help them to overcome their problems, whatever they are facing. See, it is not important that how good you are in practicing yoga or how good you are in teaching yoga. The major thing which counts and the people come to you is that how good you are at solving their problems at their physical level and mental level. And the way I teach them is to focus on these two things only. To overcome their present health issues by giving them the right format of yoga postures, right sequence of yoga postures. And of course, those who have practiced yoga with me, they are well aware that I focus on the mental aspect and I help the people to develop discipline in their life in all aspects. So those who have practiced yoga with me, they will be aware the way I have been taking sessions. Now coming to deep understanding of Veerbhadrasana 2. Not much to understand, but you see here, the lengthening muscles can be seen over here. You see here the hip adductors of the front leg, hip adductors of the back leg. Both are getting stretched, right? So now this will assist in your posture of Trikonasana. So that will help the hamstring also to get properly stretched. So you know what stops hamstring from getting stretched are the hip adductors. The first action is on the hip adductor and then on the hamstring. इसलिए most of the reason who are finding difficulty in bending forward or bending sideward, then it often happens their adductors are so tight. Suppose they are doing Titli Asana, butterfly, and they are not able to open their knee outwards properly because of the tight adductors. So the solution to tight adductors are these postures, but of course, there are some preparatory practices also. And as I told, if you want to learn those things also, I'll help you in the coming sessions. As of now, we should stick to our topic, anatomy of yoga postures. The muscles which are getting contracted now, by now you have understood quadriceps, buttocks, that is gluteus maximus, deltoid, over the hands, over the shoulders, what you see over muscle here is the deltoid, and again the muscles of the back, which is erector spinae. Now this is very easy posture to understand, where we have understood what are the muscles getting contracted, what are the muscles getting stretched, right? And also gave you the view that you should practice it before Trikonasana. Great. Now coming to Veerbhadrasana 3. See, now all these Veerbhadrasanas should be learned in a sequence. 1, 2, and 3. Now let's see this Veerbhadrasana 3. It is a good, interesting balancing posture. I have seen many people struggling in practicing this posture and they're not able to balance. Even if they are able to balance, either they have to take the hand support, or suppose the back leg is not properly raised up. The reason is not understanding the proper way to practice it. The way you practice or involve your muscles will help to improvise your posture. Believe me, it's the way the techniques are very important to understand how to make the posture happen in a very easy way. Now, coming to the muscles, the contracting muscles are the hamstrings, gluteus maximus, and erector spinae. Now, you may be wondering, ki in the lengthening muscles also hamstrings are mentioned, and in the contracting muscles also hamstring is mentioned. Now, I'll help you. The back of the body of the and the active leg, which is the leg which is raised, these are the muscles which will be in the contracted state. And the leg which is on the floor and the chest and the back to the sides of the body, these are the muscles because you are extending your hands. So latissimus dorsi will always stretch when you raise your hands over your head. So that is the best way people should start their yoga session, to raise the hand upwards. That's how they release the tightness from the latissimus dorsi, and they'll be able to move their body easily. So here the contracted muscles are hamstring, gluteus maximus, and erector spinae. Lengthening muscles are hamstring, pectoralis major, and latissimus dorsi. Let's have a look. Let me tell you about the active leg. The active leg, you see here, the red muscle, erector spinae, is contracted. The gluteus maximus muscle is contracted. At the same time, you see the muscle in the pink, basically it is contracting. The pink muscle is basically a stabilizing muscle. So the hamstring of the straight leg is also contracting to a bit. The leg which is on the floor, the hamstrings, these are the muscles which are getting properly stretched. What are hamstrings? I had told you earlier, these are bicep femoris, semimembranosus, and semitendinosus. There are three muscles which form the hamstring group of muscles, which we have learned earlier. Or if you want to revise, you can revise while I'll be sharing you the recorded version of this session. Then you can revise what we have learned today. Now you can see over here the erector spinae, and there are also other muscles which are involved in this posture, which are the rhomboids, which are there over the scapula and the shoulder blades. Trapezius is also involved. Apart from that, neck muscles, which are splenius capitis and semispinalis capitis, which helps to stabilize the head, is also getting contracted. I was not going into very deep of some muscles, but for this portion, I would like to tell you about the deep muscles also. Apart from that, deltoid, of course, that is on the shoulder, jahan par we put injection. The muscle which is used for injecting the solutions or the medicines are the deltoids. So let me have a quick view again. Veerbhadrasana 3. Veerbhadrasana 3 is a good combination of strengthening and stretching. It is like Shiva and Parvati in same pose. One group of muscles getting contracted and one group of muscles getting stretched. Of course, when you practice from the other side, that will be balanced. By default, all the yoga practices are in very balanced format. But you need to understand the right sequencing. Most of the people, they don't understand the sequence and then they make mistake. For example, I'll give you example. Immediately after a forward bending, they're trying to do a backward bending. The reason, people are doing asanas in a very quick format. Suppose if you see people practicing yoga in a group sessions, I'm not talking about colleges, because in the colleges, after every posture, they give a sufficient rest of around 30 seconds to 1 minute. But where the public yoga sessions are happening, the time gap between the postures are less. I'll take up the questions later on and help you out. So you have to understand one quick thing, that you need to understand the right sequence. The muscles getting contracted, the muscles getting stretched. By now, you are clear what are the muscles which are getting involved in Veerbhadrasana 3. Great. I have told you also about the smaller muscles, right? Great. Now, coming to another balancing posture. Today's session is more on balancing posture. So, with that, once there are few more left, some hardly 2 or 3, and then we can end up today's session with the question and answers. एक पाद उत्कट आसन. एक पाद utkat asan. See, what all postures what you have done till now were contracting the gluteus muscles for stabilizing the body. Now we have come up with this balancing posture, which is basically stretching the gluteus muscles. Gluteus maximus, gluteus medius, gluteus minimus, and very importantly, the piriformis. Piriformis is the muscle, if it gets shortened, it won't allow you to sit on floor for a longer time. Now, what are the muscles which are getting contracted? Of course, the leg which is active, which is on the floor. For that leg, the gluteus maximus, gluteus medius, quadriceps femoris, and the soleus over here, the near to the calf muscles will be active. Let's have a view. What are the muscles getting stretched? Gluteus medius, the piriformis over here, you can see a muscle being marked here. And you know, gluteus minimus and gluteus medius are below the gluteus maximus. So these are the muscles. See, you see the piriformis over here. So these are the muscles getting stretched. Now, the muscles getting contracted are the gluteus maximus of the other leg, gluteus medius, quadriceps femoris, and of course, the soleus muscle. Now, see the piriformis getting a proper stretch, which is also helping the quadratus femoris, which is for hip rotation. So, who should practice Ek Pad Utkatasana? Ek Pad Utkatasana is everyone, those who find difficult to bend forward. If you find difficulty in bending forward, take wall support, do this posture, and then try forward bending. Believe me, you will be able to do it very easily without any strain. Your body should be open and it should be properly warmed up. So if you want to, you should practice all the loosening exercises before starting with yoga postures. Of course, you are aware with that rule, so I don't have to explain that. So this is about Ek Pad Utkatasana. So if you want to improve your forward bending, then do this posture first and then try forward bending, especially Padhastasana. You will find it easier to practice it. Coming to one more balancing posture, which will be the last balancing posture of the day, which is the Uttita Hasta Pad Angushthasana. I don't think regular practitioners usually practice these postures, but I had seen BKS Iyengar telling to practice these postures in the first few months of starting their yoga journey. I was reading a book. BKS Iyengar has written nice books. So one of the book was mentioning to practice this Uttit Hasta Pad Angushthasana. Of course, he gave the easier option to raise in the front. Now this is a sidewise lifting option. So he always focus on raising it front. That is the only difference. The reason he asked to practice, he said that if you want to gain more flexibility in the yoga postures, you need to practice the difficult postures, few difficult postures in the initial stages only. That will help you to perform all the postures easily. So this particular posture, if you find the leg which is straight and the leg which is getting stretched. Of course, the lengthening muscles are the hip adductor muscles, hamstrings, gastrocnemius over here, you can see the calf muscles, and of course, below it is the soleus, and near to is the soleus, so that will also get properly stretched. Let's have a view. Now, the muscles which are contracting, the muscles which are contracting are the erector spinae. By now, you have understood erector spinae is necessary to stand straight, stand tall, to keep the chest open. The quadricep is necessary to keep the knee straight. So when you see this posture, the muscle groups which are getting stretched are adductors and the hamstrings and the calf muscles. The muscles which are getting contracted are the erector spinae, gluteus medius, and the quadriceps femoris of the raised leg. Very easy, very simple to understand. So these were the postures we have learned in today's session. If you want to revise this, you can do it. So when the recording of this session will be provided to you. And now I am giving you a bonus today, our bonus posture. And that bonus posture is Parivrtikonasana. Those who want to reduce weight, those who want to reduce weight or help our patients or the participants to reduce weight, I suggest this posture, which is called as Parivrtikonasana. If you see, the maximum muscles over here we are seeing is getting in a lengthening state. But of course, there will be contraction of few muscles. You like to know? Okay, let me just quickly tell you about this Parivrtikonasana, and then I'll end up today's session. The muscles which are getting stretched while doing this Parivrtikonasana are the hamstring muscles, the gluteus maximus. Great. It is helping the front of the chest, pectoralis major, external oblique muscles, the abdominal muscles, gluteus medius also, which is below the gluteus maximus, calf muscles also, and the soleus. And you can see these are the muscles getting stretched. And of course, there is opening of pectoralis major, which is getting a stretch. One more, the quadratus lumborum over here. It is contracting to stabilize and extend the spine. Again, the piriformis also is getting stretched, which is active for stabilizing the thigh. So see how good this posture is. It is having an active stretch, and it is also stretching the abdominal muscles. So most of the posture require abdominal contraction, but this requires proper stretching of the abdominal muscles. In the start, I had taught you how to remember the 4 abdominal muscles. Tire, T-I-R-E. T for transverse abdominis, I for internal oblique, R for rectus abdominis, the 8-pack muscle, the 6-pack muscle, and E for external oblique muscle, which you can see right over here. So you can see how beautifully the muscles are getting into stretch state. Just a quick recap. This is a good posture for weight loss. Should be practiced for ideally 1.5 minutes to 2 minutes. People can start with 30 seconds, then gradually increase their time. This is a posture where maximum muscles are getting stretched. So this should be done after end of the balancing postures. That will be the rest phase of the balancing posture. The reason I have kept here, I'm teaching you this asana along with all the balancing posture is I wanted to let you know that if you practice 2, 3 balancing postures in the session, at the end, you should make sure to practice Parivitrikonasana, which will balance all the balancing postures. So with that, we come to end of the session. What you have learned, you should apply while you're taking class or while you're doing your self-practice. Now, let me take the questions. If you found this session to be helpful for your practice or for improving your yoga class taking skills, then I'll be very happy that my efforts are, I am doing a sincere effort to help you to overcome the basic lags one faces in teaching yoga practices. Okay, let me just quickly take the question. Varsha ji, you have asked L4, L5 में disc bulge हो तो warrior 3 कर सकते हैं क्या? My answer is no. If someone is suffering from disc bulge, please immediately come into a consultation so that only the right postures are being practiced by them and no random postures being practiced by them. Okay. Dr. Swarna Goriji, namaste, Dr. Swarna. And yes, Dr. Swarna.
Namaste. Wonderful session, Dr. Vivek. I joined late. Probably I'll go through the YouTube or the link that you'll send.
Yeah, recording I'll be sharing.
Thank you.
And definitely I'll be helping with the sequence, how one has to place the postures. And Chetna ji have asked what BKS Iyengar ji has said. See, all those who are starting with the yoga practice as a students, so not about the general public, general mass, who start yoga at the age of 30, 35, or they are in the middle ages or late ages, they should not practice that. The ones who are in colleges and learning about yoga or becoming a doctor in naturopathy and yoga, they should practice this with the Hastapat and Gushtasana. I hope you could learn a lot of things from here. Okay, we have a question. If we take wall support and do Nataraj Asana or Vrikshasana, will there be any change in contracting and lengthening muscles involved? To a bit, but not much. And at the same time, you should always focus on one important aspect, that you are taking support just for a smaller time. So there will be a good balancing with wall support also. Okay. We have a question. Sir, what we can suggest to polyarthralgia patient? Okay. Tejalji, for polyarthralgia, I'll suggest they should do all the loosening practices. First of all, they can sit on chair and do that if they're not able to sit on floor. And at the same time, they should practice all the joint loosening, followed by only few set of postures. What are those few set of postures? First thing is they should practice Tadasana, which will help to stretch the whole body. Second portion for polyarthralgia patient should be the Tiryak Tadasana. Then they should lie down, practice Setu Asana and Pavan Muktasana. And apart from that, twisting. And they should also practice easy Bhujangasana, not the standard one. Easy. What do I mean by easy Bhujangasana? In easy Bhujangasana, you have to keep your hands away from the body, in the front. That is almost So normally in Bhujangasana, we keep the hands by the side of the chest. In easy Bhujangasana, you have to keep your hands 2 to 3 palms in the front. So for further guidance, you can connect me to me directly on WhatsApp. Uh, I'll give you the better guidance on the same. I have a question that we have. Can we manage trigeminal neuralgia pain through yoga? Mm, of course, but it needs a treatment support also. So I'll suggest let them go through uh, physiotherapy along with the yoga practices. That will be, see, we are practitioners of yoga, naturopathy, and physiotherapy. So we, whatever we find limitations in any other aspect, we try to involve the other therapies to overcome that limitation. So physiotherapy along with yoga will definitely help the trigeminal neuralgia patient. If you want to know more about it, you can just ping to me and directly. I'll give you the set of postures. I have a question. This class only happen on Sunday? Not exactly. Whenever there is a class, we inform you on the group, which is already made, and all the details come to the group. So if you're not in the group, what I can do is I can post a link over here. Just a second. We have a question being asked. What are the asanas we can suggest for OA of knee patients? Thank you, doctor, for asking this question, Dr. Sangmitra. If person suffering from OA, of course, he must be above 40, 45, and 50 plus. In these scenarios, we suggest them to practice more of isometric exercises like knee towel press, ankle towel press, bridge with the towel press or the ball. So we ask them to practice isometrics rather than giving more weight on the legs. Because if someone's starting yoga at late stages or when they have problems, it is not ideal to start with the yoga postures, because and then their experience will be they will say that I started doing yoga in my OA knee and then the pain got aggravated. So that's why the role of our naturopathy in yoga comes into play. These OA knee patient should connect with a proper doctor, take a suggestion, get a guidance, and then according to the person, let the doctor plan the postures for the patient. Because every posture cannot be suggested to everyone. It depends on person to person, their ability, their physical status. So we need to analyze that to suggest what posture should be done. If you want to prevent OA of knee, I will suggest to practice Utkatasana regularly. Then in your later ages of life, there will be minimal OA. See, the degeneration will take place that you know very well, but that will be minimal. What is the reason behind? Okay, we have a question from Ritika ji. She has asked, what is the reason behind Parivit Trikonasana helpful for weight loss? So reason is that it helps to contract the abdomen, it helps to stretch the body, and most importantly, you're bending forward. So this is the posture where body is getting good twist and the abdominal muscles are into good contractive state. So this will help to regularize our digestive system, and that will in turn help to eat moderately. See, yoga is not just about doing a exercise which helps to reduce weight. It is a practice which molds the mind of the person to get into a good lifestyle, which will help for the weight loss. And the reason I focused on saying Parivit Trikonasana being helpful for weight loss, because it's like priming of human brain. I know this posture is very helpful, but when I teach them priming the mind that this will help for their weight loss, they will practice it with more dedication, and definitely their dedication will increase, their diet will increase, their lifestyle will increase, and definitely there will be weight loss. For further guidance, they can always connect to BNY's doctors present throughout the country. You must be aware that we have made a Enigma directory where we have more than 1200 doctors registered all over India and world. And those doctors who are not in Enigma directory, you can go to enigma.net, enigma.net. There'll be form over there. You can just fill that form. Then you will be listed in the directory. The advantage is that directory is especially for the BNYS doctors. I have just typed the name. Actually, it has to go to everyone in the meeting. So you can just type enigma.net and you will be able to I have pasted the link. You can see in the directory where we have listed all the doctors. If you want to see details of the doctor, then you will need password to access the same. For that, you can connect with us. I'll share you a group where the password is normally shared. And those who have not joined the Anatomy of Yoga postures group, I am sharing the link in the chat. You can join that for further updates, for the further session, for further learning, and for more understanding of the yoga postures. So that's all for the day. Hope this session will make a impactful change the way you approach and look towards the yoga practice. So thank you so much for your precious time. With that, we end up today's session. I'll share the recording in the group and you can have a view of or you can revise what we have learned today. Of course, those who want PDF, they can connect to me. I'll help with the PDF. See, we are organizing this session as a gesture to help our BNYS fraternity. And most of them are from BNYS fraternity and few people are from yoga practitioners group. Anyway, signing off for the day. Thank you so much. Namaskar.